Now on Talking Solutions, want to welcome back a former guest to the show, Dan Heller with Smith's Pharmacies. Thank you for coming back in.
Oh, my pleasure. Thanks for having me.
Dan, I think we've got a different topic this time around, something they're referring to as a meningitis mandate. State law?
The Public Health Department actually has the authority to make changes to the regulations of what's requirements by the state, and that's what they did. So what the state Public Health Department did is they took in all the information they had on a certain vaccine. In this case, it was meningitis vaccine. And they said, what are the risk benefits here? And to make this a requirement to get for school-age children. And they actually came out with the benefit is much better. And so the state of Nevada, Friday, June 30th, it took effect officially. But every child in the state that's entering grade 7 and also every college freshman under the age of 23 is going to be required to have the meningitis vaccine before they can be enrolled in classes.
It's a prerequisite for going back to school.
And why did they do that age range, adolescents entering middle school, college students, was simply because those are the highest carrier rates for people that have the meningitis bacteria or virus that in them and carrying it around, and also a group of people that are in such close contact that they could pass it around easily to others. That's the reason. The state of Nevada just didn't decide these ranges. This is a recommendation by the CDC, the Center for Disease Control, that children 11 and 12 years old and college freshmen or after the age of 16 actually get 2 doses of meningitis vaccine. Once at age 11 to 12 and once going into college.
So after that point, you're good?
Yeah, unless there are other circumstances, being in other close contact situations like military, if you're going to be in barracks or things like that, or those that are traveling. For example, Mecca or the Hajj is where there's millions of people in a group, and there's a requirement when you travel there, you have to have meningitis vaccine.
Dan Heller is with us from Smith's Pharmacies. We're talking about the new thing in Nevada as of June 30th. It's got to do with school kids and what they need before they can go back into the school setting, be it either 7th grade to start middle school or the freshmen in college. Those two are what we're really concerned about. And we're talking about this meningitis mandate. Dan, I think a lot of people aren't aware exactly what meningitis is. I've always understood it to be an inflammation of a membrane that's around your brain.
You're right. Anything ending in itis, rheumatoid arthritis or meningitis signifies inflammation. And this is the area of meninges. I don't want to get too scientific, but the meninges, it's the envelope around your spinal cord and your brain. When that gets inflamed, it's not a good deal because there's no place to go when there's swelling in that area. And so that causes a lot of severity and catastrophe to the person when that happens. But we think of it as an infection. And meningitis can happen a number of different ways, but the most common type that causes long-term problems is infection, and that's the bacterial infection. There's also a viral form, which is not as severe, and usually we can recover on our own, no problem. And there's a fungal form, rare enough that I don't even know that we need to bring it up today. The main focus is bacterial and viral. The bacterial one is the one that can cause death, and that's what is the biggest concern of states like Nevada, in that 10 to 15% of people will die. And annually in the United States, that rounds out to about 700 to 900 kids that could die from meningitis, or seniors, or even the young if it's brought home into the house from carriers like middle school students or college freshmen. And if not death, another 20% get long-term complications, and they're devastating. Seizure disorders, behavioral disorders, loss of limb, actual amputations because meningitis has went septic and caused loss of circulation to extremities where they have to remove limbs. It's the saddest conditions you could ever imagine, and families get destroyed by an infection like that. But thankfully, we have a vaccine to prevent it. I think it's a great thing the state of Nevada is doing. They're not alone in making this requirement. The state of Nevada is number 31 of all the states that has put this into effect. So it's definitely a trend across the country looking at the benefits. Just get the meningitis vaccine and be done with it and rest easy knowing that we're protected.
Because it can be very severe, if not deadly, still affecting you for the rest of your life. Really
50%
chronic.
of people die or have a long-term complication that catch the bacterial meningitis.
And it is infectious, which is the concern, which is why the state of Nevada is saying before your kids go into 7th grade or before they go into freshman year of college, they need to prove to us that they have this vaccine so that we're not concerned that they're going to share meningitis with anybody else they're around.
Yes, and if I could get the message out to parents that are maybe concerned about another vaccine, or, okay, I've got to do this again, or it's a mandate the government's making me do, is just know that it's not only for the protection of your child, but it's also for the protection of others, because as a carrier, you can pass it to somebody else or bring it back into a household that could infect an infant or an elderly person with a weaker immune system. And so you really have to think about all those things first before you put your nose up to something like this.
That's a good point that you make, Dan, because it's important when you have something infectious that you are a carrier of, and you enter a home or a setting where someone has a compromised or lesser immune system, they might not be able to fight it off. I remember last year talking about the importance of getting a whooping cough vaccination. It wasn't for us. It was for that baby in the house who doesn't have a well-developed immune system yet. We could endanger them, and that's why we needed to get our flu shot for ourselves, but also people around us, so we're not infecting anybody else, and that's really important.
You're exactly right. That effect is called cocooning, protecting others around you by just vaccinating everybody possible that might be around that person that's endangered or has a higher risk level.
Dan Hiller is with us from Smith's Pharmacies. We're talking about what we're calling the meningitis mandate. Kind of a catchy name. Not something you want to catch, though. As of June 30th in the state of Nevada, if you want to send the kids back into 7th grade or get them started as freshmen in college, they need to prove that you have given them this vaccination for meningitis before they will be allowed to go to class. And we were just talking before we started the program that one of my favorite commercials every year is the one that has the Andy Williams song in the background of "It's the most wonderful time of the year." Parents are gleefully going around the store, grabbing all the school supplies, and the kids are just hanging their head going, oh man. The fact is, unless your 7th grader or your freshman in college has this vaccine and can prove it, they're not going to go back to school, and you're going to have them to deal with a little bit longer.
Yep. And let's talk about that process, if I might. It's pretty simple. I'm a pharmacist. Pharmacy is becoming one of the fastest growing providers of vaccines. And at Smith's Pharmacy, the process is pretty simple. You come in for the vaccine, or you ask, I'm interested in getting a meningitis vaccine for my child, or whatever it is that you're looking for. It could be Tdap as well, that tetanus, diphtheria, pertussis, or whooping cough one we just talked about, because that's also a requirement by the state for 7th grade. There's a consent form to fill out, which is typical for any provider, making sure there's no contraindication to getting a vaccine. There's a few questions on it, and the process is about 10 to 15 minutes. So it's a very simple process. Filling out a consent form, consultation room, pharmacist comes in, gives the vaccine. Then the record is entered into our state vaccine registry, where it becomes at the fingertips of that school district, so they know that the parent has had that vaccine, which is a nice, seamless process, and it makes it very easy for the school district to see who's had it and who hasn't.
And this can be done at any Smith stores or pharmacies all throughout the state.
Of course, you have your primary care provider. The Southern Nevada Health District is a great site as well to get vaccines. Whatever is your choice, there's many options out there.
Well, it's still nice and hot for the summer, but it's very quickly turning into back to school time. And this is an important time to realize there is another requirement for parents who have kids going into the 7th grade or going into freshman year in college. Before they can enter those classrooms and start school, they've got to show that they've had those vaccines done for meningitis.
Yeah. And just know also as a parent, you're concerned about meningitis in your child. What kind of symptoms that might show? First, meningitis, it's spread just as easy as the common cold or flu. You can catch it through the mouth or nose passage, and then it gets into our system, and if conditions are right, gets into our brain and spinal cord, and that's where it does its damage. So number one, just preventative measures. I mean, we should always be teaching our children good hand washing, cover up when we're coughing, all of those important things. But then if someone did happen to catch it, it will present like a common flu, nausea, vomiting, body aches, high fever, and that will be tough to tell the difference, and as a parent you wouldn't know that difference, but there are a couple hallmark symptoms that could develop, and if they develop, then you got to be thinking emergency room or get to your physician as quick as possible. And that is the very rigid, stiff neck, where if they're presenting all those other symptoms of flu, and then they also have this neck where it hurts so bad to touch their chin to their chest, that's a hallmark symptom. That's not a good sign. That means there's something going on in that spinal cord. They can't bend their neck very well. And number two, very severe headache. headache where their head just hurts because there's inflammation up there, that there's no place to go. So it just causes a severe headache. And lastly, you would see delusions, like they weren't making any sense or they're confused. You get into those three symptoms along with those flu-like symptoms, and at the snap of a finger, you should be grabbing the purse or wallet and out the door. Get them to the emergency room.
Because you're fighting against the clock, against some really severe things that can occur.
Yeah, I bring it up because when meningitis hits, within 24 to 48 hours, someone could die. It happens that fast. And so what they'll do if it's confirmed quickly at a hospital setting is they'll just IV antibiotics immediately to try to load your body up to fight it off.
The easiest thing to do is to make sure that you've got that vaccine so that that's not going to occur.
Prevention is just the easiest way that happens. Why not prevent it? And the vaccine lasts about 4 to 5 years, and that's why there's a repeat dose recommended before college as well.
7th grade, and then again as you're starting college. And those two will carry you through your lifetime at that point?
No, they'll carry you through those high-risk situations.
Being in the classrooms with all the other kids.
And dormitories and things like that.
Gotcha. Meningitis vaccines. State of Nevada said as of June 30th, your kids in 7th grade or starting college are not going to be able to attend unless you have this vaccine, because it's that important.
It is that important. And luckily, meningitis is not that common of a condition, about 4,500 cases nationally every year. And in the grand scale of things, that's not a huge amount. But because it is so devastating and causing of death and nasty long-term complications, that's where the benefit just comes into play, that if we have a vaccine for this, why are we not requiring it for those that are at highest risk? And that's why the state took this initiative.
Preventing meningitis for you and the people around you. Dan Heller is with us today from Smith's Pharmacies. Dan, how long have you been a pharmacist?
17 years.
Have you seen the role of a pharmacist grow in our day-to-day lives? You guys are very knowledgeable on more subjects than people realize. You're not just counting out the number of pills that go into my little pill jar.
I know. I wish it was that simple, right? That's what most people think. But actually, our coursework in college, a lot of our therapeutic courses are right next to medical students, dental students, and so everybody's taking the same pharmaceutics and therapeutic courses. So we have a lot of that background that you might not think, well, pharmacists know all these disease states and what's going on. Well, we have to know how medications will interact with them. And the paradigm is shifting with pharmacy. I saw it right when I graduated from college in 2000 and moved out here to Nevada. We slowly moved into vaccines. That was a nice addition. It just is a natural fit for pharmacy. Go to the pharmacy, get a vaccine, and then out again. But also the health coaching role that we're having now, where we do a number of different education functions like in diabetes or heart health or smoking cessation. And what's newest coming to the stage is something the legislature just passed with collaborative practice agreements this year with physicians and pharmacists working together to do medication management, meaning our strongest attribute is what medications, the strengths they should be on, how they're affecting someone's health state. And so in a collaborative practice agreement with a physician working together, pharmacists then can adjust doses based on lab results, how patients are tolerating their medications. And so that will be the next step in evolving of the profession, and we're happy to do it. We just want to be part of that team.
I think we're finding that our pharmacist is an often overlooked resource, helping us manage our health.
Well, the access is there, which is really nice. The most accessible healthcare professional out there, and what most pharmacists get into the profession for is what I got into it for. I loved the idea of just being there and being able to answer the questions. It was visiting my local pharmacist where I grew up. I had an interest in it in high school, and I was like, this guy has everybody coming to him, asking him every question about over-the-counter products, their prescriptions, their health conditions. And I'm like, I want to be that person. It led me into the profession and a lot of others, and it's just a nice service to offer. Well,
it's a resource you don't want to overlook. You've got more available to you than you realize. That would be my first point that I'd want to share with everyone on today's Talking Solutions is the role of a pharmacist in our healthcare can be a lot more valuable than we realize. And the reason why we're here talking today has to do with the meningitis mandate, which is new with the state of Nevada. And you said 31 states now are part of this requirement, saying that students need to have a meningitis vaccination before classes. If they're starting 7th grade or if they are starting freshman year in college, both of those times are very important. So don't overlook your pharmacist. get the meningitis vaccine?
Pharmacy can be a very good source for information if you're having some questions about the vaccine or any health question that you may have. And there's a couple great partners out there as well that you've probably worked with in the past, Terry. Number one, Immunize Nevada. A great source of information, and their website is immunizenevada.org. I work with them closely. I think they're a great organization for promoting public health and vaccinations. And then, of course, the Southern Nevada Health District, great source of information, and simply Googling them will get you their website and get you up and running with them too. So if I may add one more thing, a lot of people will have questions about cost of vaccine. I can tell you with meningitis vaccine, it's not the most expensive, it's not the cheapest either, and most insurance plans will cover it, which is great. But those that are uninsured, I think it's important to mention that there is great programs out there in our state called the Vaccines for Children program, VFC, and VFCnevada.org will be a website you want to know if you're uninsured and wanting to get this vaccine for your child, because it'll give locations of who are VFC providers in the state. They'll give vaccine for free. It's a great service.
So even if you're uninsured, you still want to put your kid back into school, of course. That's important. That information will be key. As always, I'll have those websites, the links and everything on our Talking Solutions Facebook page, along with the podcast of our discussion today. Dan Heller from Smith's Pharmacies. We always ask, what can we do to help you?
Well, you're doing it right now. You're getting the word out. That's the important thing. As parents may have gotten letters from schools going into the summer and just kind of tucked those under their stack of papers, and they've forgotten about it. And this is an early school year. August 15th will be the start of all classes this year, which is a couple weeks earlier than we're used to. We've got to make sure that we're on top of it, make your appointments, or get into the pharmacy, or get to the health district, whichever way you're going to get vaccine, get that done. But other than that, always be thinking about protect yourself, protect others. Who's got time to be ill anyway? That's the way you got to think when you're thinking vaccines.
Is there anything that I've forgotten?
I don't think so. I think we touched on all the products. We know what meningitis looks like. We know how to prevent it. We didn't really talk about treatment, but hopefully you'll never have to deal with that in your life. But if you do see those symptoms, get into emergency room very fast.
Get the vaccine and it won't be an issue. It is the meningitis mandate. All the information on our Talking Solutions Facebook page, along with a podcast of our discussion. Dan Heller, this is important because this has just started with the state of Nevada as of June 30th, as you're mentioning, an earlier start for the school year, August 15th. And because of that, we're jamming more stuff into that little window of time.
Making it interesting.
And one more thing for parents to be concerned about, the meningitis mandate. Appreciate all the information. Thank you for coming in to join us on Talking Solutions.
My pleasure.